Welcome to We Are Valley, a podcast by Valley Medical Center located in Renton, Washington. We Are Valley is dedicated to providing you bite-sized advice to improve your health and well-being and keep you updated on the latest medical guidance. This podcast is for informational purposes only and is not intended to be taken as medical advice. So please talk to your provider before making changes that will affect your health.
Hi folks, this is Alex McGuire. I'm one of your producers on the We Are Valley podcast and your host for today's episode. They say an ounce of prevention is worth a pound of cure. Annual checkups, health screenings, and lab work are all examples of preventive care. These routine health habits can help you and your provider catch life-altering conditions like cancer or prediabetes before they're irreversible. Today, we're joined by Dr. Kyle Wiley to help walk us through some of the details about what preventive health consists of and how we play a part in our own health. Dr. Wiley, thank you so much for being here. Can I have you introduce yourself for our listeners?
I'm Dr. Kyle Wiley. I'm a family practice physician at Fairwood Primary Care.
Perfect. So, Dr. Wiley, you're a family practitioner, which means you're providing preventive health to your patients on a day-to-day basis quite a bit. I think the thing that comes to mind most when I think of preventive care is annual wellness visits, so let's start there. Why is it so important to have annual visits?
Well, oftentimes when we see somebody come in because they have knee pain or ear pain or an acute complaint, we don't have a lot of opportunity or time to talk to that person, to get to know them, to find out what their day-to-day life is like, talk about their family, their hobbies. And we really need to know those things so that we can provide good health care for the whole person. And that is one of the main important things that we get to do during an annual exam. We get to talk to you about your day-to-day, talk to you about your lifestyle, talk to you about what you think that your health status is, and then help you to come up with ways to protect the good health status that you already have and to help you to maybe adjust some things that you're not as happy with.
Yeah, that all makes so much sense. Having my doctor be familiar with what's normal for me and know what's going on in my life really makes me feel cared for and understood when I come in for a visit. So I totally get where you're coming from. One thing I have noticed when I go in for my annual wellness visits is oftentimes my provider performs screenings. What kind of screenings are common and what kinds of things are we on the lookout for?
Well, it varies quite a bit depending on what gender or sex that you are and how old you are. I think the ones that people are most familiar with tend to be cancer screenings. So mammograms for breast cancer, pap smears for cervical cancer. There are some lung cancer screenings that we do for people who either currently smoke or smoke in the past. Other things that people may not be as aware of are going to be the more routine laboratory work that we do to make sure that your kidneys are functioning well, your liver's working the way it should, that we're not looking at any risk of diabetes or plaque buildup in your arteries from high cholesterol. And all of those things are things that we can work with you and individualize which screening exam is right for you depending on your personal circumstances.
Got it. So screenings are really specific to each patient, even though there's lots of screenings that apply to lots of people. Like you mentioned, Dr. Wiley, labs are a tool providers use to help assess different organ function. Is there other information your provider might want to know in relation to blood work? Can you give us some examples of, let's say, lifestyle details that might inform getting certain labs done?
Well, oftentimes we want to know about what your diet is like, what your activity level is like, how well are you sleeping, what's your stress level, because these are things that really impact your overall health and wellness and can have a pretty major effect on your health even later on down the line. So we're definitely going to want to ask about those types of things. And again, checking things like how well your liver and kidneys are working, your blood counts, and then tailoring any other labs that we might need to any particular symptoms that you might be experiencing.
Yeah, so a lot of information that can be helpful even if it seems small. Something else that comes to mind when I think of my annual checkup, at least for me, is that sometimes we discuss family history. Are there certain types of family history details that are good to discuss with your provider?
More than likely, your provider will have some specific questions, things that they want to know about your family history. Big ones, of course, are going to be any cancer history in your family. There are some types of cancer and cancer syndromes that can be strongly genetic,
Hmm.
and so we definitely want to know about any cancer diagnoses. We also are interested to hear about things like diabetes, high cholesterol, high blood pressure, heart attack, stroke. All of those things can have a genetic component. So always better to err on the side of caution and mention something because oftentimes it's pretty important.
An excellent segue. Circling back to what we mentioned earlier about how sometimes what we see as small details being actually quite important and helpful in the long run, why does my PCP want to know about certain habits? It can feel nosy, and sometimes questions are uncomfortable when they ask me about things like how often I drink.
It's important for us even to know if there's a remote history of smoking, drug use, alcohol use, because sometimes even though those things, those activities are in our past, they can leave marks on our health, put us at higher risk for certain conditions. It can be a little bit frightening because I think a lot of people feel like they're going to get in trouble or that somehow somebody's going to find out and it's going to have a negative impact on their life if they talk about those types of things with their doctor. But the truth is that we have no interest in getting you in trouble and no interest in any judgment for anything that you might currently be doing or previously done in the past. And really, all your doctor is interested in is making sure you're healthy now and that you keep being healthy. And the only way that we can do that is if we have all of the available information.
Okay, well, it's reassuring to know that it's to help take care of my health. Dr. Wiley, you mentioned stress being something that your provider wants to know about. What about other mental health symptoms like anxiety or low mood?
Certainly, this has been a pretty significant problem always, but particularly in the last couple of years as people have felt frightened, isolated, confused, concerned. And more I'm seeing patients come in with these concerns and complaints. And truth be told, sometimes it can be difficult to find the resources to help manage these things, but your primary care provider can be a pretty substantial source of information and treatment for depression and anxiety and other mental health concerns. It can be a good jumping off point if you need additional referrals to psychiatry or a counselor, but sometimes there are things that we can manage in the office on our own when it's a fairly straightforward case. And it's always better to check in, describe what you're feeling, let us kind of ask a couple of questions and figure out what's going to be the best course of treatment to get you back to enjoying life the way you should be.
Such a great reminder that your primary care provider is a resource and that taking care of your mental health is just as important as your physical health. Okay, last question. With COVID, I think everyone's working on finding their way back to making preventive activities part of their overall health. But have you noticed an impact on how people are doing routine annual visits? Any thoughts on this?
Unfortunately, over the last couple years, things have been a little bit unusual. And so a lot of people have been delaying those visits to their physician when there's nothing particularly wrong and they just need to check in on their health. And now we really want to start seeing people come back to the office, get in for the annual visits where we just talk about your overall health. We talk about any screening that we want to do to make sure that things are going well for you and to just have conversations about how we can work together to help you be the healthiest that you can be.
Definitely. I think that is a really important note that we can go ahead and end on. Folks, If you are looking for ways to improve your health, taking care of routine screenings and annual visits to your primary care provider are crucial. You can learn more about preventive health topics by visiting valleymed.org/utime. That's YOUTIME. Our guest this episode has been Dr. Kyle Wiley, who is a provider with our Fairwood Clinic Primary Care. Dr. Wiley, thank you again so much for chatting with us today. Thanks for listening.
This has been We Are Valley, a podcast produced by Valley Medical Center in Renton, Washington, as a part of our mission to care for our community like family. If you liked this episode, be sure to subscribe to our feed for more great health content. And for more health resources or to find a provider, visit valleymed.org. Thank you for joining us.